Good morning, dear friends. I'm Dr. Lalita here, and welcome to another informative episode of Joy of Life. March is World Lymphedema Awareness Month. Lymphedema can develop when there is damage to the lymphatic system or disruption in lymphatic drainage. Cancer surgeries, radiation treatment, etc. raise the risk for lymphedema, and arm lymphedema is seen commonly in patients with breast cancer. Today, let us listen to our SAHAI Fence participant, Mrs. Ranjana Dutt, talk about how she has managed lymphedema, followed by the expert advice of Dr. Sandhya Ravi, Senior Oncosurgeon and Founder Director of Prameya Health.
Hello everyone, this is a small note of my journey. I have been through the dark tunnel of cancer from 2019 to 2020 and by the grace of God have fully recovered now. After my chemotherapy, I was operated for breast cancer in February 2020 on the left breast. Just after being operated, I was advised to walk, but since having polio in my left leg, I was given a walker to walk with. For this, I had to put pressure on the operated side while walking. This aggravated my lymphedema in the left hand. I was advised physiotherapy and compression gloves to control the aggravation of lymphedema. I somehow could not come to terms with the situation and was very upset about the whole issue. Almost after a year of my operation, I came to know about Prameya, and this was a turning point in my life. The yoga classes with Swati ma'am and the guidance by her to do yoga without putting pressure on the affected side was a great help for the lymphedema to be under control. The true guidance by the doctors and the counselors of Prameya team was simply superb. A team headed by a warm personality like Dr. Sandhya ought to be different from others. Thank you so much.
Lymphedema of the arm is a very common but inadequately addressed problem in women undergoing treatment for breast cancer. This happens because there's a malfunction of the lymphatics due to the treatment that the person has received, be it surgery or radiation. As it can occur days, weeks, months, or even years after treatment, it is important that the lady is watchful and takes preventive steps to stop this process from occurring. How do you recognize it in the first place? It may be that you feel a little heaviness on the affected side. You may feel some restriction of joint movements, difficulty in bending the elbow, difficulty in bending your fingers. Your rings, watches, bangles may become tighter. The clothes on the affected side, the sleeves of your blouse or your dress may be tighter. You may also feel a general feeling of heaviness and pain. So these are the early signs of a lymphedema. Over a period of time, the skin becomes thicker and it does not pit on pressure. So we mustn't allow it to progress to this stage. There are a simple but few effective do's and don'ts that one can do to take care of this situation and prevent it from worsening. The first and the most important is skin care. It's important to keep it hygienic and soft and supple so that it is not prone to infections. It is also important to take some precautions to prevent injury on the affected arm. So we advise normally to avoid needle pricks and also to wear gloves and other protective apparel, especially when we are doing some heavy duty work like gardening or very strenuous jobs in the kitchen or elsewhere at home. It's also important to eat right and keep the weight under check and exercise regularly so that we get the lymph moving within the body and on the affected side. As you have just heard from Ranjana, avoiding too much pressure on the affected arm and doing the correct exercises that are taught by a trained therapist will help reduce the problem to a great extent.
That was very informative. Now let's listen in to another SAHAI participant, Mrs. Padma Menon, talk about her experiences in managing lymphedema.
Hello friends, I am Padma Menon. I am here to share my experience of managing lymphedema with guidance from Prameya. I was diagnosed with cancer of the right breast in December 2018. During surgery, doctors removed lymph nodes from my right armpit. My first and most concern was that whether I would be able to do my normal household activities. I had come to know that removal of lymph nodes leads to swelling. As the proverb goes, half knowledge is always dangerous. At that time, I always used to do some normal hand exercises to avoid stiffness. But I realized that there is some swelling in my right arm as my dresses and rings were getting tighter. During treatment, I met Dr. Poonam informed me about Prameya. When I first visited Prameya with my husband for the orientation program, I met Dr. Sandhya and got really positive vibes from her. At that time, I joined Prameya. In Prameya, our yoga teacher taught us, Swati ma'am taught us yoga and many other hand exercises. After that, I came to know that swelling means lymphedema. She also guided us that all exercises are not suitable for breast cancer survivors like Surya Namaskara. I have only slight lymphedema which I am able to keep under control with regular exercise. I was able to get proper guidance on usage of sleeves for managing lymphedema. I don't use sleeves regularly. Whenever I get numbness or stiffness of my right hand due to excessive use, I use the sleeves to manage the swelling and numbness and pain. I always keep my affected hand moisturized with flowing upward strokes like this. Before using sleeves also, I used to massage upwards gently like this only. Let me end by saying that we should take the utmost care so that the affected hand is not overstrained due to excessive use and result in swelling or numbness. With proper care and with the proper exercise, right exercises, lymphedema can be kept under check and we can lead a normal life. Thank you, Prameya.
So you've just heard from the two ladies about the effective management of lymphedema. So this effective management revolves around the four pillars of good skin care to prevent infection and keep the skin healthy. Manual lymphatic drainage, which is a gentle massage technique that will facilitate the movement of the lymph, and compression sleeves to give support to the affected arm, and appropriate exercises taught by a trained therapist to maintain the function and mobility on the affected side. Paying attention to your weight and eating right is also equally important in the management of lymphedema and to prevent the swelling from becoming worse. Each patient is different, so you must consult your treating doctor and the expert therapist to ensure that the plan is tailor-made for your needs. So regularity in exercise and following the do's and don'ts correctly will go a long way in helping you manage the lymphedema well.
As we just heard from our SAHAI friends and Dr. Sandhya Ravi, lymphedema can definitely be managed well and kept under control following all the valuable tips. Remember, maintain a healthy weight and doing the right exercises is also extremely important to control it. Do contact us at Prameya Health to learn about our lymphedema management program and also for the personalized consultations. Until next time, stay safe and stay healthy.